Hey guys, welcome back to the channel. This is Side Dental Vlogs, and today we are going to talk about how to increase your profit in your dental clinic. So why we have studied BDS, why we have opened our dental clinic, right? So that we can make some amount and so that we can fulfill our dreams and we can carry on with our life. We can buy whatever you want, but there is a limit to it and we should not be overdoing it. So how to increase your profit? So first of all, whenever we are working on the patient, okay, we have to be extremely careful. You should not be half-minded or we should not be wholeheartedly. We have to work on the patient. It's not like that you are tired and you're working. Still you have to take out some time for the patient and you have to give your 100%. The only way to advertise your work is not by digital marketing media or putting your advertisements on Facebook and YouTube. The best advertisement is the patient on which you're working. You are doing a root canal, it has to be 101% perfect and you should give your best shot to do the root canal perfectly. I know sometimes it becomes difficult. जो लोग practitioner है वो चीजें समझ पा रहे होंगे. It's very difficult sometimes to give you 100% because you will be working on one patient, another patient will be waiting in another chair, somebody will be waiting in the waiting room. So if you are not getting time, never succumb to the patient. Sometimes patient will come, tomorrow I have a marriage, day after tomorrow I will leave for US, that day I will go for Bangalore. See, if you listen to each and every of them, you won't be able to give your 100% and you won't be able to work nicely. Example I will give you. Suppose you're doing a RCT and a lot of patients are waiting in your clinic and you just obturate it. Sometimes what happens is you don't irrigate properly. Sometimes we don't use paper point properly. It happens. It's the truth. But we should not do like that. If you are not able to complete the RCT and if you feel there is an infection and it needs to be redone, you inform the patient. It's your teeth, it's your life. You have to come for another appointment. See, nowadays everybody wants single sitting. कि मेरा आज ही खत्म कर दो. Today finish my work. I cannot come to the clinic again and again. Let them not come. Don't just succumb to the patient. Because if you do some mistake and the patient is getting some kind of pain, patient will tell 10 patients that don't go to that clinic, he is not doing the work properly, right? So instead of listening to all those things, better do the work properly, give a separate appointment. Second thing which I would like to tell you that there are few softwares which are available which will remind you that some patient work is pending. Suppose a patient is coming to a clinic, root canal one sitting is over, any procedure one sitting is over, and you are so busy that you are not able to, suppose on the next appointment patient doesn't turn back to you. So you should have some system or you should have some diary or you should have some notes in which you'll be able to know that okay, this patient work is incomplete. See, what I do in my clinic is there is not much, I don't use any softwares, but what I do is I keep a diary, okay, particularly for the root canal I do it. Suppose I write the name of the patient, I write the tooth number where the root canal is being done, I write the phone number of the patient, and I make one column in which I have written like how much amount the patient has paid, in which lab the crown has gone, right? So these all things I write, and at the last there is a patient signature after finishing of the work. So suppose the patient in the first appointment has paid some 2000 rupees, so I write it there, and it's only the diary for the root canal, right? And then I leave it. On the if the patient misses the appointment, after every 10 days I check what all patients they have not come, and suppose you will be able to know, right, which all patients have not paid. So you can call them and you can remind them कि okay, the work is still pending. Some patients will come back. ऐसा नहीं कि बिल्कुल नहीं आएंगे, because many people are having work. किसी घर में कुछ problem हो जाता है and some and all other issues going on. So at that time you can tell the patient to come back to your clinic. This is the second method to gain more profit. Third thing we often we crib, oh, there is no patient today, क्या करूँ मैं? So what you do is you open your diary, you check whether any other patient for the next day is available. Suppose a patient misses an appointment a particular date. Suppose today patient didn't come because today is Holi and Holi is tomorrow actually, and today, the day before, many people go to their native places. So I called up one patient and she told that she won't come. So what I did is I called the next patient which was on Saturday and I told them, if possible, can you come today? So In this way you have to manage your appointments. So I didn't go just sit like idle. Okay, I did some work, and I finished the work which was there on Saturday. So Saturday I could give one more patient. And in a patient you have to check the entire teeth. This is the fourth point. Entire teeth you have to check any problem is there or not. Okay, because suppose we are doing a root canal and patient tells there are other filling needs to be done, and we tell okay root canal खत्म हो जाएगा फिर हम filling कर देंगे. फिर at the time when filling gets root canal gets over and you put the cap, and after that when you are about to do the filling on the same day when the patient is telling, because at the last day you will forget or the patient will forget, and every patient is equal to 32 patient. Just remember that, right? So you have to check all the teeth, any problem is there or not. What I usually do is before placing the crown, I tell the patient to go for an oral prophylaxis, because if the patient doesn't go for oral prophylaxis, what will happen, sometimes food lodgement will be there, and sometimes patient will have some kind of bad smell and pain, and after placing of the cap, patient may tell you that after placing of the cap this happened. So usually what I do, I clean the teeth before placing the cap. Usually in 80% of the cases patient do agree to them. And this is the fourth way. Fifth way, your availability at the clinic is very important. You should take breaks from the clinic, but it's not like that you're taking 15 days 20 days break. You can take once in a year, but try to be present in the clinic most number of days, right? Like Monday to Saturday, Sunday take a holiday. If you are feeling overworked, take a break for 2-3 days, okay? And don't get irritated on the patient if you're angry for some reason. So last thing I would like to tell you is be calm whenever you're working, okay? Be patient. Patient will come, and whenever you're working on the patient, never get irritated on the patient, because your behavior matters a lot, okay? More than your skills, your behavior, your soft skills, how you're talking to the patient, these things matter a lot, okay? And show respect towards the patient. Even if the patient is disrespecting you, you can tell the patient, or you should not talk to the patient. But as being a dentist yourself, never show your anger, or try to be as calm as possible. That is the only thing which will give you more patients, your behavior, your presence in your clinic, your skills. So these are the things which I have learned. These are the basic things. I am repeating it once again for you people. So I hope you will like this video, and if you like this video, share as much as you can. And there's a root canal live course which I have given in Graphy by Unacademy. You guys can join that course till the end of the month. There's an offer going on, and it's a basically 40-minute course in English. You will be able to know the access opening of upper anterior teeth, premolar teeth, and lower molar teeth, and how to use the endomotor files. Suppose you're a beginner, and how to use the endomotor, and there are a lot of things in that video. So I will give the link of the video in the description box. Till then, take care. Bye bye.